Headaches. Headaches are a very common medical problem and a common cause of disability among men and women. Headaches interfere with the ability to work and to perform daily tasks. Some people have frequent headaches, other people hardly ever have them. Causes. Although headaches can be painful and distressing, they are rarely uh, a sign of indication of a serious condition. Most headaches, tension type, migraine, and cluster headaches, are not caused by another identifiable disorder. Tension type headaches are the most common. Less commonly, headaches result from another disorder. Usually, the disorder is not serious. Disorders that cause headaches are often minor or temporary, that affect the eyes, the nose, throat, sinuses, teeth, jaws, ears, or neck. Rarely, headaches are caused by a serious disorder. Such disorders include a head injury, a stroke, bulge in the wall of an artery supplying the brain, or the called the cerebral aneurysm, brain infection, or a brain abscess, meningitis, and encephalitis, and blood vessel arteriovenous malformation near the brain. Of course, infections such as tuberculosis may affect the brain and cause headaches. Disorders that increase pressure within the skull can cause headaches by putting pressure on the brain. And again, skull is what keeps the brain intact. And because there are examples that a brain tumor, bleeding, or a hemorrhage and accumulation of blood, a hematoma, and pseudotumor or cerebri, in which pressure within the skull increases but no cause can be identified. And remember, hema is the Greek word for blood. Other serious diseases that may cause headache include very high blood pressure, which may produce a throbbing sensation in the head. However, high blood pressure does not usually cause headaches. Lung disorders, such as emphysema, that reduce the oxygen supply to the brain may cause headaches, as may sleep apnea, which temporarily increases levels of carbon dioxide in the blood. Inflammation of large arteries, known as temporal arteritis, usually in the neck and head, may cause headaches. Temporal arteritis affects older people primarily. Severe cases of influenza and high fever may cause headaches. Lyme disease in its early stages commonly causes headaches. Headaches commonly result from withdrawal of caffeine, withdrawal of analgesics after long-term use, and use of certain drugs that widen blood vessels such as nitroglycerin. Diagnosis. Usually doctors can determine the type or cause of headaches on the basis of the person's medical history, the characteristics of the headache, and the result of a physical examination. Of course, characteristics of the headache include its frequency, duration, its location, severity, and associated symptoms. The following characteristics may indicate that a serious disorder is the cause of headaches, and it could prompt medical attention if so required. Frequent headaches in a person who rarely has headaches, mild headaches that become severe, headaches that awaken a person from sleep, or any change in the pattern or nature of headaches, headaches which are associated with symptoms such as a fever and a stiff neck, changes in sensation or vision, weakness, loss of coordination, or fainting. For example, a severe headache with a fever and a stiff neck suggests meningitis, a life-threatening infection of the layers of tissue that covers the brain and the spinal cord. A headache that occurs suddenly and that is more severe than any others that the person has experienced suggests a subarachnoid hemorrhage, often due to a ruptured aneurysm. When doctors suspect a serious disorder, additional diagnostic procedures are usually performed. If meningitis is suspected, a spinal tap or a lumbar puncture is performed immediately. A spinal tap may also be performed if doctors suspect a ruptured aneurysm. Occasionally, blood tests are performed in order to check for a disorder such as Lyme disease. The erythrocyte sedimentation rate, or ESR, the rate at which red blood cells, or RBCs, settle to the bottom of a test tube containing blood, may be determined to check for temporal arteritis. A high ESR, again, erythrocyte sedimentation rate suggests inflammation. If a doctor suspects a tumor, stroke, hemorrhage, or another structural brain disorder, computed tomography or CT or magnetic resonance imaging MRI of the head can be performed as well. Concerning tension type headaches, a tension type headache is usually mild to moderate, band-like pain that affects the whole head. The cause of tension type headaches is not well understood, but it may be related to a lower than normal threshold for pain. Stress may be involved, but its role is not clearly understood, and it is not the only explanation for the symptoms. Symptoms and diagnosis. The pain is usually mild to moderate, although it may be severe. It feels like tightening of a band around the head, making the whole head ache, literally. Of course, the pain may last 30 minutes to 1 week. Unlike a migraine headache, however, a tension-type headache is not associated with nausea and vomiting, and it is not made worse by physical activity, light sounds, or smells. Tension-type headaches typically start several hours after waking up and rarely awaken a person from sleep. The diagnosis is based on the person's description of the headache and, of course, the results of a physical exam. No specific procedures can affirm the diagnosis. Rarely computed tomography or magnetic resonance imaging of the head is performed to rule out other disorders that may be causing the headache, particularly if headaches have developed recently. Concerning treatment for most mild to moderate tension-type headaches, almost any over-the-counter anesthetic, such as aspirin, acetaminophen, or ibuprofen, can provide fast temporary relief. Massaging the affected area may help relieve the pain as well. Of course, severe headaches may require stronger prescription medications, some of which contain opioids or narcotics, such as codeine or oxycodone. For some people, caffeine, an ingredient of some headache preparations, enhances the effects of anesthetics. However, overuse of anesthetics or caffeine can lead to chronic daily headaches. Such headaches, called rebound headaches, can occur when a dose of an analgesic is missed or late when or when caffeine intake is reduced or stopped altogether. Concerning migraines and migraine headaches, a migraine headache is a throbbing, moderate to severe pain, usually on one side of the head, of course, and it worsens by physical activity, light, sound, smells, or that which is associated with nausea and vomiting. Although migraines can start at any age, they usually begin between the ages of 10 and 40. In most people, migraines recur periodically, but they usually become significantly less severe, or they resolve entirely after the age of 50 or 60. Migraines are 3 times more common among women than among men. Migraines tend to run in families. More than half of the people who have migraines have close relatives who also have them. The cause of migraines is not well understood. According to one theory, migraines occur when arteries to the brain become narrow or constrict, and then they widen or dilate. Dilation is thought to activate nearby pain receptors. However, this theory is too simple in order to explain the complex changes in the blood flow that occur in the brain during a migraine. Furthermore, a series of changes in the nerve cells of the brain occur before the changes in blood flow. A rare subtype of migraine called familial hemiplegic migraine is associated with a genetic defect on chromosomes 1 and 19. The role of genes in the more common forms of migraine is under study. Estrogen, the main female hormone, appears to trigger migraines, possibly explaining why migraines are more common among women. During puberty, when estrogen levels increase, migraines then become much more common among girls than among boys. And of course, some women have migraines just before, during, or just after menstrual periods. As menopause approaches, when estrogen levels are fluctuating back and forth, migraines become particularly difficult to control. Oral contraceptives, which contain estrogen, and estrogen replacement therapy often make migraines worse. Insomnia, changes in barometric pressure, and hunger may also trigger migraines. And of some symptoms and diagnosis in a migraine, throbbing pain is typically felt on one side of the head. The pain may be moderate, but it is often severe and incapacitating. Physical activity, light, sounds, or smells may make the headache worse. The headache is often accompanied by nausea, sometimes with vomiting. A migraine attack often involves more than a headache. It may also involve or include a prodrome, an aura, and a postdrome. The prodrome is a change in mood or behavior which can precede the rest of the migraine by 24 hours. People may become depressed, elated, irritable, or restless. Nausea or loss of appetite may also occur. About 25% of people experience an aura. The aura involves temporary reversible disturbances in vision, sensation, balance, movement, or speech. Commonly, people see jagged, shimmering, or flashing lights, or they may develop a blind spot with flickering edges. Less commonly, people experience tingling sensations, loss of balance, weakness in an arm or a leg, or difficulty in talking. The aura occurs within the hour before the migraine and ends as the migraine begins. About 25% of people experience a postdrome, which involves changes in mood and behavior after the migraine. Migraine attacks may occur frequently for a long period of time, but then they may disappear for many weeks, months, or even years. Migraines are diagnosed on the basis of symptoms, and so no procedure can confirm the diagnosis. If headaches have developed recently or if the pattern of symptoms has changed, CT or MRI of the head is performed in order to exclude other disorders. Prevention and treatment. Treatment of migraine headaches involves 3 types of drugs. Drugs to prevent migraines, drugs to stop or to abort a migraine as it is beginning, and drugs to relieve the pain. People who have more than one migraine a week often benefit from taking drugs every day in order to prevent migraine attacks. Beta blockers such as propranolol are often given first. Calcium channel blockers, antidepressants, and some anticonvulsants, particularly the Valproex, are also effective. The choice of a preventive drug is based on the side effects of the drug and on other disorders that are present. For example, if weight gain could cause problems, the Valproex is usually not prescribed. If the person has depression, a tricyclic antidepressant such as nortriptyline may be prescribed. To abort a migraine as it is beginning, most doctors prefer a relatively new group of drugs called triptans, or 5-hydroxytryptophan, or 5-HT. Triptans specifically target the receptors that stimulate the nerves supplying the cerebral blood vessels. Thus, triptans may reverse the dilation of these blood vessels, which contributes to a migraine. As soon as people sense a migraine attack is beginning, they take one of these drugs in order to stop the attack from progressing further. Other drugs used to abort migraines, such as ergotamine, are sometimes used, but they are not as safe or as effective as triptans. Because triptans and ergotamine cause blood vessels to narrow or to constrict, they are not recommended for people who have angina or other heart disease, for people who have prodromal symptoms that resemble those of a stroke, because constriction of arteries may trigger a stroke, especially if you have not enough blood pumping. It could cause blood clots and things of that nature, which could then lead to a stroke. For less severe migraines, analgesics alone or ones that contain caffeine can be useful. They can be taken as needed during a migraine, or instead be taken instead of a triptan. As for tension-type headaches, overuse of anesthetics or caffeine can make the migraine worse, and for more severe migraines, opioids may be needed. Considering cluster headaches, a cluster headache is a severe pain that is felt at the temple or around the eye on one side of the head that lasts a relatively short time, less than 4 hours to be exact, and that usually occurs in groups for about 6 to 8 week period. Cluster headaches are relatively rare, affecting only about 1 to 4 of 1,000 people. Cluster headaches affect mostly older men that are older than 30. Use of alcohol or nicotine may trigger attacks. Of course, the symptoms of an attack almost always start suddenly and last 15 minutes to 3 hours. It may begin with itching or a watery discharge from one nostril. Intense pain on the same side of the head follows and spreads around the eye. The pain often awakens people from sleep. Because the pain is so severe, people with cluster headaches cannot lie down, frequently pace, and sometimes bang their heads. After the attack, the eyelid on the same side as the headache may droop, and the pupil often constricts. The headaches are usually not associated with nausea and vomiting, however, and they are not worsened by light, sound, or smells, as are migraines. Of course, the attacks may occur twice a week, up to several times a day. They usually occur in groups or clusters for a 6 to 8 week period, occasionally longer, followed by a headache-free interval of several months before they reoccur. They may recur at the same time of day or night, and diagnosis and treatment is based on the person's description of the headache and the accompanying symptoms. If the pattern of symptoms changes, CT or MRI is performed concerning the head. Most people with cluster headaches need to take drugs in order to prevent recurrences. Drugs include those used to prevent migraines, verapamil, lithium, indomethacin, and occasionally methotrexate. Oxygen given by nasal prongs, or the corticosteroid methylprednisolone gives by mouth, can stop or abort a cluster headache as it is beginning. So there are all kinds of drugs used to treat migraines. I won't go into the different types of drugs, but there are ones that are preventive, such as anticonvulsants, beta blockers, calcium channel blockers, and serotonin blockers. We have tricyclic antidepressants. We have abortive drugs, ergot derivatives, antiemetic drugs, and triptans. And, of course, we have the side effects for all of those, and then the analgesic, which is non-steroidal anti-inflammatory drugs, or NSAIDs, and, of course, opioids as well. There are a lot of different types of headaches. Again, we have tension-type headaches, migraine headaches, cluster headaches, high blood pressure, hypertension, eye disorders, iritis, glaucoma, and papillitis, and sinus disorders, brain tumor, brain abscess, meningitis, subdural hematoma, subarachnoid hemorrhage, a temporal arteritis, and other disorders that they affect the brain, such as cancer, cryptococcosis, sarcoidosis, syphilis, and tuberculosis. Again, if it's a tension-type headache, the pain is usually mild to moderate. It feels like tightening of a band around the head. It affects the whole head. The pain lasts about 30 minutes to 7 days. Headaches are not worsened by physical activity, light, sounds, or smells, and they are not associated with nausea and vomiting. Concerning a migraine, the pain is moderate to severe and usually is felt on one side of the head. The pain lasts for about 4 hours to 3 days. Headaches may be worsened by physical activity, light, sounds, or smells, and are associated with nausea and vomiting. Attacks can occur for a long period of time, but then they disappear for weeks, months, or years. Often the attacks are preceded by a sensation that of a migraine is beginning, such as mood changes, loss of appetite, and nausea, temporary disturbances in sensation, balance, muscle coordination, speech, or vision, such as flashing lights and blind spots. The diagnostic procedures for tension-type headaches are CT or MRI of the head. That could be performed in order to rule out other disorders, particularly if the headaches have developed recently or if the symptom pattern has changed. Concerning migraines, the procedures are the same as those for tension-type headaches. Concerning the procedures for cluster headaches, they are the same as for those as tension-type headaches. The characteristics of cluster-type headaches, the pain is severe and piercing, and it is focused around the eye. The pain lasts for 15 minutes to 3 hours, and because the pain is so severe, people with the cluster headaches cannot lie down. They frequently pace and sometimes bang their heads. Headaches occur in clusters separated by periods when no headaches occur. They are usually not worsened by light, sound, or smells, and they are not associated with nausea and vomiting. On the same side as the pain, the nostril runs, the eye waters, the eyelid droops, and the area below the eye may swell. A type or a cause is the cause of a headache, which could be high BP or hypertension. Severe high blood pressure that has been present a long time can cause headaches. The pain is throbbing, it occurs in spasms, and it is felt at the back or the top of the head. BP is measured, and blood tests and kidney function tests are performed concerning the diagnostic procedures. For eye disorders, again, glaucoma, iritis, an eye examination is performed, and the pain is moderate or severe, and it is often worse after using the eyes. It is felt at the front of the head or or over the eyes. Sinus disorders. The sinuses are x-rayed or CT scan is performed. The pain is severe and may be dull or sharp. It is felt at the front of the head. It may begin suddenly and last only a short time, or it may begin gradually and be persistent. It is usually worse in the morning and less severe in the afternoon. Cold, damp weather and lying down make the pain worse. And that is for sinus disorders. Concerning a brain tumor as the cause of headache, pain is mild to severe and becomes progressively worse. It usually recurs more and more often and eventually becomes constant without relief. Headaches are often worse when the person lies down and may awaken the person from sleep. A gradually growing tumor causes a headache that is worse when the person first awakens. The new development of such headaches requires medical attention. And again, an MRI and a CT is performed concerning a brain tumor that might be the cause of mild to severe headaches. Tend to become progressively worse. Concerning a brain abscess, the pain is mild to severe and intermittent. It may be felt in one spot or over the whole head. The pain is similar to that caused by a brain tumor. However, if an abscess ruptures, acute meningitis results, causing an intense headache and a very stiff neck. Again, an MRI or CT is performed. Concerning meningitis, the pain is severe and constant and is felt over the whole head. It travels down the neck, making bending the neck to rest the chin on the chest difficult. People with meningitis feel ill, they have a fever, and they might vomit. They definitely will vomit if they have meningitis. Blood tests and a spinal tap are performed. Subdural hematoma. The pain is mild to severe and intermittent or constant. It can be felt in one spot or over the whole head, and it travels down the neck. An MRI or CT is also performed. Subarachnoid pain. The pain is severe. Concerning this hemorrhage, it is constant and widespread. Occasionally, it is felt in and around one eye. The eyelid droops. People often describe the headache as the worst ever experienced. A MRI or a CT scan can be performed. If the results are negative, a spinal tap is performed. Concerning temporal arteritis, the pain is felt on one side of the head at the temple. The arteries in the temples may be enlarged, and the disorder may cause disturbances or a complete loss of vision. A biopsy of the temporal arteries is performed, and the erythrocyte sedimentation rate, or ESR, is determined. Concerning other disorders, if they affect the brain, such as cancer, cryptococcosis, sarcoidosis, syphilis, and tuberculosis, the main type of pain may be mild or severe, and it may be dull or sharp. Of course, it is felt over the entire head. People whose headache is caused by one of these disorders have a moderate fever and a history of the disorder. And again, a simple spinal tap and an MRI or CT are performed. And of course, one, some, or all of the characteristics listed may be present. Again, CT is computed tomography, MRI is magnetic resonance imaging.